Hi friends, welcome to Plexus Ortho. My name is Dr. Kanan Kumar and I'm an orthopedic consultant at Plexus Ortho. Today we're going to discuss about an MCQ that we put up a couple of days ago. The MCQ was MCQ number 212, which said a male neonate who was 4.5 kgs at the time of birth and had a difficult forceps delivery. So anything beyond 3 kgs of weight is slightly overweight in the Indian situation. So he has had a difficult forceps delivery. So usually in terms of orthopedics, you must think about brachial plexus injuries. You must think about cerebral palsy or difficult due to difficult labor. So these are the couple of conditions that you must think about when somebody says you have a difficult forceps delivery. At birth, his arm was adducted and internally rotated and extended at the elbow. So which part of the brachial plexus is affected? So all of us know this is an obvious spotter. So the child is having an adducted arm, extended elbow and internally rotated arm as well. So this is basically called an Erbs palsy. What is an Erbs palsy? Erbs palsy is an involvement of the C5 and C6 nerve roots. So C5 and C6 nerve roots combine to form the upper trunk, and that is where this is affected. So let us look at in a little more detail. Why is it not C5, C8? If C8 is involved, patient will also have a loss of extension of the elbow and extension of the fingers, and fingers will not function. C5 to T1 will be a totally flail upper limb, that is there will be no activity at all. And C8 T1 is an opposite of Erbs palsy, that it will be a Clumpcase palsy, that will be a complete claw hand affection of the intrinsic muscles of the hand. So therefore the correct answer to this question is number 3, C5 C6 Erbs palsy. That is Erbs point involvement. So let's go through a little bit about the basics of the brachial plexus. The brachial plexus comes out between the scalenus anterior muscle and the scalenus medius. So basically the plexus comes out between these two scaleni muscle, and the artery also comes along with the plexus between the scalenus anterior and the scalenus medius. The scalenus posterior is behind these two muscles, and between the medius and posterior is where the subclavian vein comes across. So when there is a compression of any of these muscles, it can cause thoracic outlet syndrome. It can cause a syndrome of the subclavian artery vein compression. So these are some things that can happen, and you should be able to remember it. Okay, you can also see a phrenic nerve depiction in this picture, which lies on the scalenus anterior muscle. It's an extraplexal nerve, so it arises outside the plexus, and therefore it is called an extraplexal nerve. Okay, so all of us know the plexus is made up of C5 to T1 nerve roots. Basically, plexus is an intertwining of the nerves, and then they become separate into the cords and individual nerves. So therefore there is an intertwining of these roots, and this is called as the plexus. So the C5 and C6 root combine to form the upper trunk or superior trunk, and C7 continues as the middle trunk. C8 and T1 continue as the inferior trunk. The trunks further divide into anterior and posterior divisions, and then all the posterior divisions of the upper, middle and lower trunk continue to form the posterior cord, and the anterior division of the upper and the middle trunk continues the lateral cord, and the anterior division of the inferior trunk continues as the medial cord. I won't go into the details of each of the nerves. This is the basic anatomy of the brachial plexus. So very briefly, this is how it functions. So one more thing you must understand is what is the cords in relation to the lateral cord, posterior cord and the medial cord. These cords are in relation to the axillary artery. Next, coming to Erbs palsy. Erbs palsy is an involvement of the C5 and C6 nerve roots. So basically C5, as all of you know, starts, C6 root is here. They both join to form the upper trunk, right? At the upper trunk there are two branches. One is a nerve to the suprascapular nerve, and the second one is a nerve to the subclavius. This is of no significance. The nerve to the suprascapular nerve is the one which is very significant, and it gets affected in this C5 to C6 injury, or the Erbs point injury. This is called the Erbs point. So what is that called? That is called the Erbs point, and the nerve may be injured here, or the plexus is injured here. This is called the Erbs point. And if this is affected here, then it affects the deltoid muscle, the biceps and the brachialis muscles. So therefore the hand hangs by the side and is rotated internally, adducted, and has a is commonly called as waiter's tip hand. So therefore it is Erbs palsy, C5 to C6 affection and the patient and the baby shown in the picture, and this clinical scenario given was a Erbs palsy which involves C5 and C6 roots. Clumpcase paralysis or Clumpcase palsy is extremely rare as compared to the Erbs palsy. Erbs palsy is 90 to 95% of cases. Clumpcase forms only about 5 to 10% of the cases, and it involves the C8 and T1 nerve roots are affected. So it principally affects the intrinsic muscles of the hand and the flexors of the wrist and fingers, and therefore there is a clawing of all the fingers, and there is an intrinsic muscle wasting and weakness. And this is called as Clumpcase palsy, which involves the lower roots, that is the C8 and T1, and it is far less common as compared to the Erbs palsy. Now, sometimes you may have a total brachial plexus injury that is involving the C5 to T1, that is a completely failed upper limb, which with disastrous prognosis, and this commonly happens in large babies with gestational diabetes mellitus, with difficult labor, forceps delivery, vacuum assisted. So usually cephalic presentation babies with overweight babies are a problem, okay, and underweight babies, if they are underweight and breech, they can cause this kind of a brachial plexus injury. Basically, therefore, when the head is being extracted, there is an increase in the angle between the shoulder or clavicular region and the head. So this is what causes a stretching of the nerves and causes a rupture of the nerves at the level of the spinal cord, the roots where it comes out from, and therefore this can cause obstetric brachial plexus palsy. So there is a classification for obstetric brachial plexus palsy. It is called Naraka's classification. Naraka's classification basically classifies into Erbs palsy. First, Erbs palsy is involvement of the C5 and C6 roots, where the shoulder abduction external rotation is lost and elbow flexion is lost. Then you have the extended Erbs palsy, where you have the C5 to C7 involvement, where you have loss of elbow extension as well. Then you have the total brachial plexus palsy, where C5 to T1 is involved completely, and this will cause a completely totally flail upper limb. Then the fourth variety is called as the Clumpcase palsy, where C8 to T1 is involved, and this is an unusual thing where only the lower roots are involved and the patient will have a clawing of the hand. So this is in brief about the obstetric brachial plexus injuries. So basically the most common obstetric brachial plexus injury is the Erbs palsy. Erbs palsy is C5, C6, where the roots join to become the upper trunk, and the upper trunk where the suprascapular nerve is given off, that is called the Erbs point, and that is where this injury can occur, and that is where you have the waiter's tip hand. And then you have the Clumpcase palsy, which is less common, involving the lower roots. So this is, you have to remember this very clearly, because this is asked often in your exam, and I am sure you won't make any mistake in this. Thank you very much. My name is Dr. Kannan Kumar. I am an orthopedic consultant at Plexus Ortho. Thank you.